So next I will call up Dr. Mritika Sen to present on impact of COVID-19 on features and management of 830 consecutive patients with uveal melanoma.
Good morning, everyone. So, as we know, COVID 19 affected all branches of medicine, including ophthalmology, and we have a number of publications on this. But when we do a literature search on reports on the impact of COVID 19 on ocular oncology, there is a dearth of reports, with the first one coming in from India on retinoblastoma. Followed by one from United Kingdom on the impact of COVID-19 on uveal melanoma. Both these studies showed that patients who were presenting during COVID-19 had more advanced disease, and many of them required enucleation as compared to the pre-COVID era. So, the purpose of this study was to evaluate the management and outcome of patients with uveal melanoma before and during the COVID 19 pandemic and the related restrictions. So, this was a retrospective study which was done on patients who were treated between January 2018 to October 2021. And we classified the period as pre COVID 19, included the years 2018 and 19, and the period after COVID 19 was 2020 and 2021. Patients were treated with either iodine 125 plaque radiotherapy or enucleation. So, looking at the overall numbers in each of the year, there was no statistically significant difference in terms of the total number of patients presenting in 2020 or 2021. But when we look at the monthly distribution of the patients, there was a significant drop between April to June 2020 that corresponds to the fewer number of patients who were being referred to as well as presenting with symptoms to the clinic. When we look at the tumor thickness, again, per month, there was a rise in the in the thicker tumors presenting during COVID from June 2020 onwards. In terms of the treatment, there was an increase in the enucleation rate, which was observed in 2021 as compared to the other years, but this was not statistically significant. When we look at the monthly distribution of the patients, again in the June of 2020, corresponding to the fewer number of patients presenting, there was a drop in the number of patients who were being treated with plaque radiotherapy. However, this returned to an overall consistent value in the following year in 2021. In terms of the number of patients who are undergoing enucleation, in January of 2021, there was a dramatic increase in the number of patients who required enucleation. So, we compared the corresponding periods, 9 months between January to September in 2019 versus 2021, and we found that there was a significant increase in the tumor thickness as well as the number of patients who required enucleation, indicating that patients were presenting with neglected large and extensive tumors. To conclude, COVID-19 pandemic did result in delayed presentation of these patients and who came with more advanced disease. There has been a documented increase in the number of patients requiring enucleation, and this is something that we probably need to follow up in future. Also, in terms of the patients who are presenting with the type of genetic mutations. Thank you.
Very good study, Dr. Mritika. I'd like to ask those cases which you enucleated between January to September, 9 months. All those 19 were new cases, or they were follow for the long term and post treatment, or what they were?
So these were all treatment naive patients. These were the patients who underwent primary enucleation.
Okay. So, did you analyze or sub-analyze in your study that that they could have come earlier, or was there any questionnaire asked to them when
So,
they
yeah.
noticed the symptoms, and when did they
Right.
come?
So we did look at whether the patients were, when the symptoms started and the duration, the gap between the beginning of the symptoms and their presentation to us, there was no significant difference in, like, there was no delayed presentation as such from the time of onset of symptoms as compared to the previous years. And there was no delay in the treatment as such, because ocular oncology was being treated as on an emergent basis. So as soon as they presented, they were being treated.
Okay, great presentation, Nitika. So I was just curious to understand, like you said that during the COVID pandemic, they presented in advance with an advanced disease. So what did you look into? What were the reasons behind this delayed presentation? Was it socioeconomic? Was it transport? Or
Yeah, there were multiple factors involved. Majority of the times, especially with uveal melanoma, one thing that we found significant when patients were presenting during COVID pandemic was that those patients, there were more number of patients presenting with pain. Now, pain is not a very common symptom in uveal melanoma. Most of the time they're asymptomatic. So when patients are asymptomatic, they were really not going to the either the primary centers or to the tertiary levels for any eye condition, unless it was an emergency with red eye or with pain, which is not seen with uveal melanoma. Other than that, every other factors which have been found important were, there was problem with transportation. There were a lot of restrictions in terms of patients who are coming from beyond a certain distance. But other than that, in terms of the treatment being provided, there was no delay. So these were in just the restrictions imposed for the lockdown, which was causing a delay.
okay, thanks, Nitika.
Yeah, but then you just noticed that there was no delay in presentation from patients. Then what exactly do you feel was like different during COVID? Like why did the tumor thickness
Right.
and enucleation, this thing increased, the
Right.
rate increased?
So I don't. So one of the things was that, again, patients are asymptomatic till they notice visual acuity decreasing, which does not happen unless there is SRF in the macular area or the tumor is involving the posterior pole. So they're not going for the routine checkup. Even patients who probably had nevi earlier were not really following up. It was only when they started having the symptoms that they were going to the ophthalmologist.
So one just quick question. So what do you feel is the, like, what is generally the main presenting feature otherwise pre-COVID? What was the presenting feature, or most of the patients were detected in a routine follow-up? So that could have been
Yeah.
the...
Yeah, that is one of them. Many of them were just patients who knew they had a nevus, but being followed up regularly. But the most common symptom is decrease in visual acuity, for which they present to the clinic. Thank you.